Hi everyone, this is Jennifer. I am one of the CMAs for the NCCAA Health staff. Today's discussion will be on allergies, anaphylaxis, and epinephrine auto-injector. We will go over the importance of allergies, anaphylaxis, and the use of the epinephrine auto-injector. We'll go over the signs and symptoms, triggers, and medications. What is an allergy? An allergy is an abnormal response to a normal substance. Some symptoms of allergies are watery eyes, runny nose, sneezing, rash, and hives. An allergic reaction could be caused by certain foods, some drugs, insects, mold, pets, pollen, and products, especially latex. What is anaphylaxis? It's a life-threatening allergic reaction, a severe reaction to a specific allergen or allergic trigger. Symptoms of anaphylaxis: skin rashes, itching or hives, swelling of the lips or tongue, throat, shortness of breath, trouble breathing or wheezing, dizziness and or fainting, stomach pain, bloating, vomiting or diarrhea, uterine cramps, feeling like something awful is about to happen. Anaphylaxis triggers can include, but are not limited to, food, biting or stinging of insects, medications, and latex. Exercise-induced anaphylaxis is also possible. How to handle anaphylaxis reactions. Be aware of the students in your classroom that have life-threatening allergies. Be aware of what the student is allergic to, for example, nuts, latex, bee stings, foods. Recognize the signs and symptoms of an anaphylactic reaction. Learn to use an EpiPen. The health staff will conduct center-level training as needed. Respond to these symptoms. Do not ignore. If a child has allergies, the child is required to have a individualized healthcare plan, IHCP, according to Performance Standard 1302.47B76. The purpose of the individualized healthcare plan, IHCP, is to ensure the staff are aware of the child's medical condition and have a plan from the child's physician on medical interventions. This is a sample of the IHCP with the health condition listed as allergic to bees. This middle section should be filled out by the child's pediatrician. No blanks should be left in this area. If something does not apply, the doctor can write "not applicable," NA. The doctor does need to sign this form and date it, along with the parent signature and date. Epinephrine is the most important treatment available. This quickly restricts blood vessels, relaxes smooth muscles in the lungs to improve breathing, stimulates the heartbeat, works to reverse hives and swelling around the face and lips, usually wears off in 10 to 20 minutes, sometimes requires a second dose. It's critical that 911 is called and students transported to the emergency room. The most common epinephrine auto-injectors that we will see at the centers will be the Auvi-Q and EpiPen. These are the ones that are circled. EpiPen comes in two different doses. EpiPen Junior is 0.15 milligrams for children under or approximately 66 pounds. EpiPen 0.3 milligrams is anyone over approximately 66 pounds. So how you'll administer the EpiPen or EpiPen Junior. Number 1, you prepare. Remove the auto-injector from the clear carrier tube. Hold the auto-injector in your fist with the orange tip pointing downward. Blue to the sky, orange to the thigh. With your other hand, remove the blue safety release by pulling straight up without bending or twisting it. Number 2. Administer. If you are administering to a young child, hold the leg firmly in place while administering an injection. Swing and push the auto-injector firmly until it clicks. The click signals that the injection has started. Hold firmly in place for 3 seconds. Count slowly. 1, 2, 3. Remove the auto-injector from the thigh and massage the area for 10 seconds. Number 3, get emergency help right away.
A life-threatening allergic reaction, anaphylaxis,
is unpredictable. It could be mild 1 minute, then suddenly...
It's scary, like you can't even breathe scary.
Or your skin gets all itchy and breaks out into hives scary.
or your throat starts to tickle and close scary. It's different for everybody.
Every reaction is different. A mild reaction one time can be life-threatening the next. So it's important to know your body and know when it starts to feel funny. It could be the warning signs of anaphylaxis.
So it's also important to know how to use one of these.
An EpiPen auto-injector.
EpiPen and EpiPen Jr. are for the emergency treatment of life-threatening allergic reactions.
And for people who are at an increased risk for these reactions.
EpiPen and EpiPen Jr. should only be used to help someone during an emergency.
Ready to show them how it's done?
Yeah,
EpiPen Jr., the one with the green label, is for kids.
like me.
An EpiPen with the yellow label for bigger people, like me.
Whether you need to use EpiPen on yourself or give it to someone else, you can just follow these simple steps. So first things first, you take it out of the tube,
Just flip open the yellow cap,
or the green cap,
slide it out, and hold it like this.
Blue to the sky,
Orange to the thigh.
Then you take off the blue cap.
Blue safety release.
never put your hands near the orange tip because that's where the needle comes out.
The needle is designed to go through clothing, including jeans, because it must be injected into the outer thigh for quick absorption. If you're helping a young child,
Like me.
hold the leg firmly in place. Once it is,
You just do this.
Boom.
It clicks, so you know it worked. Then you hold it there for 3 seconds.
Then, remove EpiPen.
you'll still see some liquid in there, but don't worry, your EpiPen Jr. auto-injector gave you the right dose, and it has a special feature, the never see needle.
Yeah, so the needle's totally covered up.
So you should never see the needle.
Then rub the spot for 10 seconds while you or someone else gets emergency medical help right away.
Call an ambulance.
Or have someone take you to the emergency room. Just make sure to do it immediately.
And you should always carry 2 EpiPen auto-injectors wherever you go. They even come clipped together.
Because some people might need the second dose.
Take your expired or used EpiPen auto-injectors to your doctor's office and ask for a refill.
Remember, epinephrine is the only first-line treatment for anaphylaxis, not antihistamines.
So just trust yourself and do it. Don't hesitate, especially if you know the symptoms of a life-threatening allergic reaction and have practiced with the great trainer that comes in the box.
Because this is what's important to people like me.
And me.
So Auvi-Q comes in 3 different doses. 0.1 milligram for infants and toddlers weighing 16.5 pounds to 33 pounds. 0.15 milligrams for children weighing 33 to 66 pounds. 0.3 milligrams for anyone 66 pounds and over. How to administer Auvi-Q? Step 1, you'll pull the Auvi-Q up from the outer case. Step 2, pull the red safety guard down and off of Auvi-Q. Step 3, place black end of Auvi-Q against the middle of the outer thigh. Push firmly until you hear a click and hiss sound, and hold in place for 2 seconds. Auvi-Q does give voice automated instructions.
If you ever have to inject your young child or infant using Auvi-Q, Epinephrine Injection USP, the auto-injector is equipped with helpful voice instructions. You simply start by pulling the Auvi-Q up from its outer case. The voice instructions will walk you through the injection process. The auto-injector will operate even if the voice instructions do not. I'll demonstrate in one moment, but first, this is important to know. Only inject into the outer thigh, through clothing if necessary. When administering Auvi-Q to a young child or infant, hold their leg firmly in place before and during the injection to minimize risk of injury. Let's get started.
If having an allergic emergency, pull red safety guard down and off of Auvi-Q. After removing red safety guard, place black end against outer thigh. Then push firmly until you hear a click and hiss sound, and hold in place for 2 seconds. 2, 1, injection complete. Seek emergency medical attention. This Auvi-Q has been used and should be taken to your physician for proper disposal and a prescription refill.
Things to remember. Do not administer expired medications. Check the 5 R's: right child, right medication, right dose, right route, right time. Also, write documentation. Make sure that your documentation is thorough. Call 911. Once the epinephrine auto-injector is used, place it in a plastic baggie and give to parent or EMS. In case of an emergency, always call 911. In summary, there is no cure for allergies. You can manage allergies with prevention and treatment. The best way to prevent an allergic reaction is to avoid your allergens. It is important to prepare and have an allergy action plan. Always carry your epinephrine auto-injector with you. Resources that were used for this presentation are as follows: Asthma and Allergy Foundation of America, Center for Disease Control and Prevention, EpiPen.com, and Auvi-Q.com. Time for post-test questions. Number 1, describe 2 allergy triggers. Any of these will be acceptable: food, biting or stinging of insects, medications, and latex. 2, what is anaphylaxis? A life-threatening allergic reaction, severe reaction to a specific allergen or allergic trigger. Number 3, describe one allergic reaction that could require the use of an EpiPen. Anaphylaxis. This concludes the PowerPoint. Thank you for watching.